Good morning, everyone, and thank you for coming to our event. We're talking about the opioid settlement executive order signing. My name is Maura Rossman. I am the Howard County Health Officer. I'd like to begin today by introducing our great county executive, Dr. Calvin Ball.
Thank you so much, Dr. Rossman, and thank you all for being here today for this important update on the opioid epidemic here in Howard County. When I took office as your county executive in 2018, I knew that the opioid crisis was something that we needed to take bold action to address. Working together, we created pathways to combat substance abuse disorders while supporting our neighbors in need. Because of our hard work and collaboration, we've seen approximately a 34% decrease in fatal overdoses over the past 3 years, and a 41% decrease in non-fatal overdoses over the past 5 years, at the same time that overdose rates were increasing around the country. In 2022, we reached our all-time low over the last 5 years with 111 non-fatal overdoses compared to 188 in 2018. We continue to follow recommendations to combat substance use disorders, including ensuring access to care for patients with an opioid disorder, protecting patients with pain, and providing harm reduction services to help prevent overdose and spread of infectious disease. However, we can do more to combat this crisis, which is why we've worked with 31 other states' attorneys generals, including Maryland, to file litigation against opioid manufacturers as a way to invest in more resources than we already do. We must continue to engage in a collaborative way to be both strategic and transparent in how this money will be used. And that's why today I'm proud to sign an executive order to officially establish the Opioid Collaborative Community Council, or the OOOC. This council will be responsible for providing recommendations on how Howard County should use its settlement funds, and specifically, they'll work to identify gaps in resources and services, explore effective ways to increase access to those resources and services, and recommend appropriate harm reduction, treatment, and follow-up care initiatives. All the progress we've made up until this point is due to our strategic partnerships and our shared commitments. Opioid manufacturers created a public health crisis that led to hundreds of fatal and non-fatal overdoses in Howard County, throughout the state of Maryland, and our nation. Their product was a scourge on our community. In December 2017, national litigation against opioid manufacturers began, and Howard County filed its own lawsuit in May of 2019. In 2022, states and subdivisions reached a settlement, and as a result, Howard County received approximately $230,000 in December of 2022 and is expected to receive over $12 million in the next 15 to 20 years. Now that we have begun to receive money as a part of our settlement with some opioid manufacturers, it's important that our community has input into how those funds can be best used to prevent future opioid misuse. The Opioid Collaborative Community Council will be comprised of over 15 representatives who will bring professional expertise and lived experience into the discussion. They will also be supported by over 10 government, school system, and public health employees so that implementation of their recommendations can be seamless and coordinated. Many of the council's representatives are in this room today. Thank you so much for your service and your continued dedication. And you'll be hearing from one very shortly. I thank you all for making sure that all of our residents are seen and cared for. I also want to thank every person who has worked hard to get us here, every person who will be serving on this council, and every person who will ensure that we can help save lives. We will continue our work to ensure that every person has the access to the best resources and care so that they can live their very best life. And now it's my honor to sign this executive order. Thank you all very much. Now I'd like to turn it back over to Dr. Rossman.
Thank you, County Executive Ball. Now it is my privilege to introduce Mrs. Barbara Allen, a member of the Opioid Collaborative Community Council.
Good morning. I want to know if it's like when we get bill signings by the governor, if I can have the pen.
Why do you think it's still there, Barb?
Okay, I got a pocket. You know, there's just things you have to have your little swag, right? But I have to tell you, I'm just thrilled. I'm just getting, if I go like this, it's because I'm getting teary. So I want to say a couple of things. When I first came into advocacy, I was very, very naive. I was an expert in IT, which had nothing to do with the solutions that we've been looking for here in Howard County and the state of Maryland as well. And I came for 4 reasons. Because I lost my son, Jim, my brother Bill, my brother Tom, and my niece Amanda. So to this disease, to this scourge. And so it's an honor that I do their work. But it also is an honor of all the other folks who come together and work together to make solutions, because what we're looking for is hope and healing. That's what we're looking for. Over time, I came to really, truly appreciate the complexities. I honestly didn't understand how to make a law. I didn't know how they were passed. I didn't know how budgets were done. I didn't know where money came from. I knew there was this organization called Congress, you know, but how did the money then come down through SAMHSA, as an example, and then to the health departments from the state and into the local levels? I didn't understand the connection with public safety and so many other things. So I had a lot of learning to do. But I decided that because I'd lost 4 people, I could humble myself and go off the IT expert to really being ignorant, totally ignorant. And that's what I've done. So I'm so thrilled because in this room today are people who represent our police department, fire and rescue, detention center, the hospital, people in recovery homes that work with women and children and men. I know I'm going to forget somebody. Our detention center, if I didn't say them, because this is a collaborative. We have people in this room who are in recovery. We have people in this room who have buried loved ones or who have loved ones who are struggling to recover. So for me, this collaboration, that's such a critical word, this is not easy. This is complex. And the more we know, the more we work together, the more we learn processes that the police go through or that our EMTs go through or that our providers go through, the better solutions we build. So as we're provided this opportunity to make recommendations and suggestions on how to invest the monies coming into Howard County, that's fabulous. Because what we provide for our county exec and all those who deal with the funding in so many ways. Let me tell you, you don't want me to talk about funding because you'll be here all morning. But I'll be here afterwards. But that's where it counts. That's where having the community's words and attention come into play. And I got to tell you, I'm really proud of Howard County. I'm really proud for a couple of reasons. And I warned somebody earlier, I talk too much and I get teary. So, but that's okay. My tear glands work fine. But honestly, Howard County is the only jurisdiction in Maryland that has a group like this, that brings together those who do our police work, our fire and rescue, our detention center, our hospitals, our providers, as well as the community, integrated, because we learn from one another. When someone says, well, what about women and children, for example? And somebody says, what do you mean women and children? We know, we understand. We're the only county that actually does that. And with this executive order, with a pen clearly in my pocket, we're also the only jurisdiction that has brought this group together to make decisions on how to invest in their county. And I can tell you, because I work at the state level as well as the federal level, there are many jurisdictions, there are many people who are jealous who said to me, how did you do this? It's because we've been collaborating for more than 2 minutes. We've been collaborating for quite some time. And we saw the writing on the wall. And as you all know, sometimes you don't have, as my friend Beth said the other day, a playbook. You have to create it. When I worked in IT, somebody came up with an idea, and then we floated it to see if we could make it happen. That's exactly what we've been doing and what we'll continue to do. So, Dr. Ball, I thank you for the pen, but more importantly, I thank you for this executive order, which moves us forward to continue supporting Howard County for hope and healing. So I thank you all for being here this morning.
Thank you, Barbara. As Barbara mentioned, long before the interruption of the pandemic, where at least public health has been hyper-focused on for the past 3 years, we have been working on the very issues that we're here today. And so it is, I don't know, maybe especially poignant as we're sort of recovering from the pandemic, that we have this executive order today and a renewed commitment. We haven't lost that commitment, but a renewed public commitment to the ongoing other crisis of the opioid issue that we've faced before and we continue to face. I want to thank County Executive Ball for this ongoing commitment to address the opioid crisis in Howard County. We know, as Barbara mentioned, we're not immune despite our great partnerships and other assets that our community has. And the partnership, like the OCCC, which she mentioned, brings together experts and other community members from the public and private sectors to ensure that all of the available resources and expertise is available to address our needs. In the health department, our behavioral health team works every day throughout the pandemic to reach individuals who struggle with opioid misuse, to prevent opioid overdoses and death, and we're excited to continue the collaboration with the OCCC. Our peer support staff, some of which are here today, have remained on call 24 hours a day to help reach people where they are, when they need it, through day or night. And our behavioral health navigation team continues to link individuals in need of assistance with a warm handoff to a provider or resource that can help meet their specific need. And today I see many of our providers in the audience, so thank you for being here. Through the sharing of ideas, methodologies, brainstorming that Barbara mentioned, and data, we're data-driven, we creatively look for new approaches to expand prevention, response, and harm reduction. And I'm really grateful to be part of also Howard County, because we have courage. We have courage to try new things, to be brave, and to pivot when needed. The strength of this particular council is that it provides a voice to community members on this very important issue. One that has cost the lives of too many of our friends and families, and we don't need to raise hands, but I bet everyone in this room has been touched by this crisis. To ensure that all the needs of our diverse county are heard and addressed in culturally appropriately manners. By working in this collaborative and multidisciplinary environment, Our partners will endeavor to identify gaps and increase access to critical resources and services for all our residents. And it's not often that we have manna from heaven or funding coming down, which the county worked hard to get to be able to fund the strategies and creative ideas that we come up with. So this is really important. In turn, we believe that this renewed collaboration will continue to decrease the number of opioid overdoses. We still have far too many. And to expand access to treatment resources, we still need more, and services needed by those who continue to struggle with opioid misuse in their families. So on behalf of your local public health, I thank you. I thank Dr. Ball, and I thank Barbara Allen. I thank all of you for supporting us and coming today.